So, Dr. Birx, I want to ask you about your views on public health, which we're looking at because of this nomination, potentially, of Robert F. Kennedy Jr. HHS has wide portfolio here. Vaccines, medicine, oversees Medicare, regulates food, beauty products, baby formula, reproductive health care. What would the impact be of having someone without government experience in that top job?
Well, I think the most important thing is what team he would bring with him, because you're talking about really a large cap corporation with a highly diverse group, which you have to really bring together and, frankly, eliminate some of the duplications that between these agencies to really become more cost effective. And so really having a management person at his side, a chief of staff perhaps, that has really come out of industry, that would know how to bring and look and bring those individuals together that are running the other agencies, because it's a very HHS is probably one of our most complicated departments.
So you're saying people with experience around him, we need to look at those lower level appointees Mr. Trump might make. Well, what's so interesting with RFK Jr. is how he has in some ways tapped into this health movement in America. He's talking about more regulation, not less, when it comes to American food. Here's some of what he said. Those sound like good goals. Can he actually take on big agriculture and get that through?
I think because of a lot of the people who are suffering the most from these additives are actually people in our rural areas. 16% of the Americans live in a rural area, but they are providing all of our oil and gas, all of our fiber, all of our cotton, and all of our food. And the level of diabetes in these communities, because of their access to certain foods, is extraordinarily high. I just came out of the field. 58% of the adults in the town that I was just in had already diabetes or pre-diabetes based on a household survey where we went house to house. This is the reality of America. And so what I'm hoping is he brings his transparency for all Americans, and we really start to tackle these issues one by one by one. I think everybody across America wants to have healthy kids that they know will grow up and not end up with the complications of diabetes or heart disease.
It was very hard for Michelle Obama when she was First Lady to get any of that done. And it might be hard for lawmakers who come from some of those agricultural states to vote against their own interests in terms of the farm subsidies and the like.
Well, we're not talking about eliminating good food. We're talking about using all of their ingredients in a way that is more healthy for Americans. And I think that's what people are calling for now. Europe did it years ago. And I think we're capable of doing that. We are really smart, high levels of technology. We can make food tasty without a lot of these additives because we can see that other groups are doing it in a small way. So we're not talking about eliminating the need for wheats and grains. We're talking about putting those together in a healthy way.